Hello, my name is Kate Kunkel, and I'm a community coach with the County Health Rankings and Roadmaps program. And I'm joined by my colleague, Mary Bennett, who is also a community coach.
Hello, it's wonderful to be joining all of you today, and thank you for taking the time to be part of this. I'll be chatting out messages and answering questions throughout, and then following up afterwards.
We are also excited to have Joanne Lee, a senior project officer with Active Living by Design, with us today. And she's going to share how some communities have worked on obesity prevention in early childcare and early learning settings in an effort to build a culture of health.
Greetings, everyone, and thank you, Kate and Mary, and to your team for inviting us to be part of today's webinar.
Great, we're excited to have you here. So first, we want to acknowledge the important relationship that we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Next, we want to take a moment to get you oriented to the technology that we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, and this is where you'll see our screen throughout the presentation. And on the right, you can see the control panel, and this is where you can interact with us. So please feel free to ask questions or share your thoughts and experiences with us using that question box throughout the webinar today. And we will be sure to leave time for questions at the end of the webinar. So for each presentation that we do, we really like to have a guiding question. And this question, why do we care about diet and exercise, and what can communities do to impact this focus area, guides our webinar today. I'm going to lead things off with a very brief overview of the County Health Rankings and Roadmaps, and then we'll do a deeper dive into the diet and exercise focus area of our model. We'll look at some of the measures that we use and why we include them as part of the rankings. And then I'm going to turn things over to Joanne to share some examples of how 3 communities that she's worked with through Active Living by Design are working to increase nutrition and physical activity in early child care and early learning settings. We chose this topic specifically after hearing from many of you that this was a particular population of interest and one that doesn't always get quite as much attention as, say, the broader community or school-aged groups. And we'd love to hear throughout the webinar what strategies your community is using to address this issue. You can use that question box to share with us what's worked well in your community, and include your community name if you'd like, so we can share that with others on the webinar if time allows. All right, so we'll get started into sort of the main part of our webinar. As we move through the content, we want you to consider these questions as you listen. Who else might you want to share this information with? Remember, we archive these webinars so others can watch it later. What's one idea for action that you're taking from this webinar? And what else do you need to know to take action or use this information? So for those of you familiar with County Health Rankings and Roadmaps, this is probably a very familiar picture to you by this time. But we like to start with a brief program overview to ground our discussion in the County Health Rankings and Roadmaps. This will be really short, maybe 5 minutes. If you're newer to us, this will give you a high-level overview of County Health Rankings and Roadmaps. To learn more, we encourage you to check out one of our Rankings and Roadmaps 101 webinars. Mary's going to chat out a link to our most recent recording from April. So this image shows the relationship between policy health factors and health outcomes. This is our rankings model. It illustrates why it's important for communities to take a broad definition of health. There are many factors that impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks, the quality of our schools, access to healthy foods, community safety, social connectedness. All of these things really impact our health outcomes and the health of our communities. So starting from the bottom in that reddish-orange box, we know that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. And that there are many health factors that shape our community's health outcomes. We specifically are looking at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes to show how healthy each county is: the length of life and quality of life. Today, we're going to focus on diet and exercise. That focus area in our health behavior section of the model. We'll walk through it in a bit more detail, some of the measures that we use for this and why they're important. But we aren't just going to focus on the data, because the whole reason that we produce the county health rankings is to move communities to action. With that in mind, I want to share the Take Action cycle. This is the how within the rankings and roadmaps. It lays out the process communities follow to improve health. We start at that top right part of the circle with assessing needs and resources, and work clockwise around to act on what's important and evaluate. You'll see that communicate and work together sit outside the cycle, because working together and communicating with stakeholders are essential throughout the Take Action cycle. I should actually say they wrap around the cycle, not so much sit outside. At the heart of the Take Action cycle is people working together, because we know that solving issues like childhood obesity that we're going to talk about today, or poor high school graduation rates, or crime require the wisdom and resources of everyone in the community. The Roadmaps to Health Action Center includes guidance and tools to help communities keep moving along this cycle. One of the tools found in the Action Center, and also under the Roadmaps to Health tab on the website, is What Works for Health. And we're going to talk about that a little bit later in the webinar. And on the webinar, we're going to showcase some of the policies and programs that you can find to impact diet and exercise in your community. We also know that there are many approaches that communities can take to tackle this complex and challenging issue. Joanne's going to share a few ideas and examples of how some communities are working to implement a strategy to improve nutrition and physical activity in those early learning settings. But before we get into that, let's look at how we measure diet and exercise in the county health rankings. As I mentioned, the diet and exercise focus area falls under the health behavior factor. So why do we care about diet and exercise? Well, for starters, we have a major issue with overweight and obesity in the U.S. and the poor health outcomes that come with that. But it's not just about healthy weight. We know that good nutrition and physical activity are both essential for good health, and that a poor diet or a lack of physical activity, regardless of weight, can lead to health issues. We also know that the environments where we live, learn, work, and play affect our access to healthy food and opportunities for physical activity. In the county health rankings, we use 4 measures to assess diet and exercise. We look at adult obesity. We have a food environment index. We look at physical inactivity and access to exercise opportunities. We're going to walk through each of these measures in a bit more detail, though you can find more information for each measure on the aptly named Measure Detail page. There you'll find the data, a longer description of the measure and why it's included in the rankings, some of the strengths and limitations of the measure, and you can also find the data source and a link to the policies and programs to address that particular focus area. So let's look at each of these measures in a bit more detail. So the first measure we have, I sort of mentioned, is adult obesity. This measures the percentage of the adult population, age 20 and older, that reports a body mass index greater than or equal to 30. The county values for this measure range from 12% to 48%, with a U.S. average of 31%. So this was a popular webinar today, we assume in part because many communities are struggling with this issue. There are very few that can feel good about where they're at when we think about diet and exercise and obesity. We use this measure. It's a good indicator of the overall problem. We know that weight is mostly a result of diet and exercise, calories in and calories out. And the 2 major contributing factors to obesity in most cases are excess calorie consumption and too little physical activity. So let's take a look at that physical activity piece of the puzzle. Our measure here is one of physical activity. This is maybe one of the more obvious ones. This is the percentage of adults aged 20 and over reporting no leisure time physical activity, which includes running, calisthenics, golf, gardening, or walking for exercise. In the US, over a quarter of adults report getting no leisure time physical activity. There are a few things to note here, though. First, because this measure considers leisure time activity and its self-report, it may or may not include things like active transportation, which some people might consider to be leisurely, others might not. I sometimes consider my bike ride to work leisurely. Other days, it feels less leisurely. Another thing you may have noticed is that this measure and the obesity measure look at only at adults. We know that many communities are working to prevent and reduce childhood obesity, and in fact, that's the focus of this webinar today. We don't have any measures for children actually throughout the county health rankings because we aren't able to get that data at a county level for every county in the US. But this is where we recommend that you dig a little deeper into local data sources to look at this issue. You may also want to look at things like what your school district's requirements are for physical activity, or what's happening in your early child care centers, like we'll talk about today. How walkable is your community? You may already be collecting some of this information or thinking about collecting other data in your community that could add to this information, like a walkability study. Because we want all people to be active, children and adults, and where you live can impact your access to places to be physically active. So our next measure is access to exercise opportunities. This measures the percentage of individuals in a county who live reasonably close to a location for physical activity. So those locations include things like parks, state, local, or national parks, and recreational facilities, which include a wide variety of facilities, including gyms, community centers, YMCAs, dance studios, and pools. The real question is, how easy is it for people to get to a place, outdoors, indoors, formal or informal, where they can be active and or play? More and more communities are looking at joint use agreements, for example, to address this issue so that existing spaces in schools can be used by others in the community when it's not in use for school. Also think about what other data might be helpful to consider along with this information. For example, community safety comes into play. Having a park near your house might not be that much of an asset if it's not very safe or you can't easily get to it. Joanne is also going to highlight a program that shows how communities are thinking creatively about space and physical activity for kids. All right, so we've talked about obesity and we thought about the physical activity side of the equation. Now let's take a look at the other half and think about the food environment. The Food Environment Index, this is the last measure that we have in our diet and exercise focus area. We had a few questions on the webinar registration about this one, so we're going to go a bit deeper here. The Food Environment Index ranges from 0, which is the worst, to 10, the best, and equally weights two indicators of the food environment. We'll get to those in just a moment, but first, what does your index number mean? If your county's number for this measure is below a 5.5, that means this is likely a pretty significant issue in your community. If it's below a 7.5, it's below average, and again, might be an area for further exploration. Above a 9, and you're likely doing well and should continue to do good work in this area. So it's best to sort of understand this number compared to how you're doing compared to others. So let's look a little deeper into what this measure considers. Now that we have a general understanding of the index number, what makes up the Food Environment Index? The first is limited access to healthy foods. This is defined as the percentage of the population who are low income and do not live close to a grocery store. The second indicator that we consider is food insecurity. This estimates the percentage of the population who did not have access to a reliable source of food during the past year. These indicators are combined into the Food Environment Index measure because it's important to see that there are many parts to a healthy food environment. It's not just, do people have access to healthy foods, but are they actually able to put food on the table, among other things. So the measure is intended to be a guidepost, and both of the indicators can be found in the additional measures section, and I'll show you how to get there in a moment. And we really encourage you to go there to look more closely at your data for access to healthy food and food insecurity to better understand really where your challenges lie within the food environment. We're seeing more and more communities working not just on obesity, but on the issue of food insecurity. And we recently had a webinar with Joplin, Missouri. It was actually to talk about their coaching experience, but it also highlights their work in this area of food insecurity. And I think Mary is chatting out a link to that webinar archive. All right. Getting to the additional measures. So you can click on the Measures tab at the top of your state landing page, and it will take you to the premature death measure page. So this is a sneak peek of that measure detail page, but I kind of covered up a lot of it but with the pictures there. If you click the down arrow that's in that box that says premature death, you'll see three options: health outcomes, health factors, and additional measures. You can then click additional measures, click health behaviors, and then you can click whichever of those indicators or additional measures you want it to look at. Alternatively, you can get there from your county snapshot. At the top of your snapshot, just below your county name, is a snapshot tab and an additional measures tab. When you go to your county snapshot, you see the county snapshot. That's the first thing you see, but you can click on that additional measures tab, and you'll be able to see all of the additional measures that are available for your county. Okay, so that's an overview of the measures we use for all the data people out there, but the rankings data is just a starting point. As with the rest of the measures in the snapshot, these 4 measures are just a starting point for investigating and discussing ways to improve health. Using the rankings data, which is a tool found under the rankings tab on the main navigation bar of the website, will help you find and understand the data for diet and exercise, and really the rest of the data on the site and beyond as you begin to assess your needs and resources and move on to focusing on what's important. So I'm going to take a little break from talking and, after providing the overview of diet and exercise. And as I mentioned earlier, that's just a starting point for communities to take action. So now I'm going to introduce Joanne Lee from Active Living by Design. And she's going to share some examples of how a few of the many communities she's worked with through her work at Active Living by Design are working to prevent obesity in early child care and early learning settings. She's going to share the models these communities are using and the unique aspects of their work that are part of their success. As a Senior Project Officer for Active Living by Design, Joanne Lee provides technical assistance and support to partnerships and partners across the country in their efforts to develop and sustain healthy communities. Her work assisting and coaching community partnerships covers all phases of planning and implementation and spans across several national and state portfolios. Joanne also engages directly with funders and leaders in the field to build capacity and develop healthy community strategies that have an impact and are sustainable. She's worked in many diverse settings in North Carolina, Hawaii, and Arizona, and we're really excited for her to share her great knowledge and expertise with us. So thanks for being here today, Joanne. And if you can, just first start by telling us a little bit more about one of our great partners at County Health Rankings and Roadmaps, Active Living by Design.
Thanks so much, Kate. I'm really pleased and excited to be part of this webinar. Active Living by Design was launched in 2002 as a national program office of the Robert Wood Johnson Foundation. And initially, Active Living by Design was focused primarily on active living and then healthy eating approaches, sustainable approaches in community settings. Over time, and since our inception in 2002, we've really grown to really focusing on creating community-led change and serving as a catalyst for a culture of health by working with local, state, and national partners to build a culture of active living, healthy eating, and really healthy communities in general. Our team at Active Living by Design is very multidisciplinary, just as the County Health Rankings Take Action cycle has at the heart of that cycle. We are also multidisciplinary. Our staff has expertise and experience in public health, public policy, planning, community development, communications, nutrition, design, business, and social work. Active Living by Design, in terms of our experience and our services, they cover a variety of areas to support communities, funders, and other partners interested in supporting healthy communities. We provide technical assistance, coaching, and training across a range of strategies and contexts. We support funders in their initiatives, and we capture stories. We glean lessons and disseminate best practices. Over time, we've collaborated with 7 funders across 10 major grant programs. We provided TA and coaching to nearly 200 partnerships across 30 states, and including DC and Puerto Rico. And we've engaged in many, many other consulting and advisory relationships. What I really want to mention, Kate, is just how privileged Active Living by Design feels to have a great view of what we call the view from the middle. We've been able to work directly with communities and watch how they actually take action on the ground and implement models and strategies. And we've also been able to be in touch with funders and those who are interested in investing in the kind of change that we all want to see in communities and across our nation.
Yeah, I agree, Joanne. I think that you have a really great vantage point and that you are close to that community work, but that you get a broad perspective too, since you work with so many communities around the U.S. And are able to learn from each of them. And we're excited to hear more about a few of them today that are working to prevent childhood obesity. And I think we're going to kick things off with Nash and Edgecombe counties in North Carolina.
That's right, Kate. And before I move to the Nash-Edgecombe story, I do want to mention that all of the community examples that I'll be sharing with you today are connections that we made through our most recent large national initiative, which was Healthy Kids, Healthy Communities. And that initiative ran from 2008 to 2014. It was a 5-year, $33.4 million national program of the Robert Wood Johnson Foundation that helped 49 community partnerships across our country in support of healthy eating, active living, and childhood obesity prevention. This funding endeavor served as the Robert Wood Johnson Foundation's largest community-based initiative focused specifically on reversing the obesity epidemic in children at greatest risk based on race, ethnicity, income, and or geographic location. So the stories that I'll share with you today come from some of the Healthy Kids, Healthy Communities partnerships with whom Active Living by Design has had the pleasure to work with, and it represents just a component of these partnerships' much broader work and efforts to create a culture of health in their communities. So let's start by sharing the story that happened in Nash-Edgecombe Counties, North Carolina. And just to give the audience out there a sense of this community, Nash and Edgecombe Counties are comprised of small towns in rural eastern North Carolina where Southern traditions remain strong. The Twin Counties have a large population of minority families, a rapidly growing Latino population, and high rates of unemployment and poverty. The community was hit hard in 1999 by Hurricane Floyd and the ensuing flood, and in many ways the community is still recovering from the environmental, social, and economic impacts. I want to talk a little bit about the lead agency for the Healthy Kids, Healthy Communities partnership in Nash and Edgecombe counties. The Downey's Partnership for Children really did not have a primary focus on health when it first started. And they began as a cross-sector group of concerned community leaders when they incorporated in 1993 as a public-private partnership. At that time, they became the Smart Start Partnership for the Twin Counties. Smart Start is a statewide early childhood initiative designed to ensure that all young children enter school healthy and ready to succeed. It's based on a locally controlled system of nonprofit organizations that design and implement early childhood education systems and strategies based on local needs. Well, in 2010, the Downey's Partnership for Children really started seeing that health really was so connected to much of the work that they were doing through Smart Start and their broader collaborative. And so in 2010, they developed a Healthy Kids Collaborative, which has grown to include 70 multi-sector partners, including community organizations, local government, educational institutions and organizations, parents, and residents. The Healthy Kids Collaborative works through 5 subgroups representing priority focus areas for the community: medical, outdoor learning environments, child care, physical activity and nutrition policy, and family engagement. So this partnership, the Downey's Partnership for Children, really serves as a driving force in changing policies and practices to support healthier environments for young children in their community.
All right, they sound like a pretty amazing partnership, so I'm excited to learn more about what they're doing.
Yes, they definitely are a strong and large, diverse partnership. And as part of its mission, the Downey's Partnership for Children and its partners work with child care centers to promote best practices for healthy eating and physical activity. In 2011, they became a regional hub for the Shape NC initiative. Shape NC is an initiative of the North Carolina Partnership for Children and the Blue Cross and Blue Shield of North Carolina Foundation. The approach of Shape NC is interdisciplinary, and it really brings together leading experts in early childhood education, nutrition, physical activity, and landscape design to create 18 model child care centers across the state of North Carolina. The goal of Shape NC is to improve children's healthy development through built environment, nutrition, and physical activity interventions. These centers are trained also in creating policies and environments that ensure that children get regular active play, engage in play spaces, and have healthy foods and beverages. What's really great about Shape NC is that it builds upon the success of existing programs by bringing together 3 proven strategies to reduce childhood obesity. And I'll talk about those 3 programs. The first is the Nutrition and Physical Activity Self-Assessment for Child Care, or NAPSAC program, which focuses on improving nutrition and physical activity policies and practices in child care. The second is Preventing Obesity by Design, or POD, through which the National Learning Initiative provides design assistance and training in order to create outdoor learning environments that increase active play for children. And the third component of Shape NC is Be Active Kids, which utilizes programs to increase healthy movement. So we'll talk a little bit more about each of these 3 components. And I think, Kate, probably also from the work that you and your team do with communities, so much of the art of being able to take impactful action at the community level involves being able to draw on models and promising practices, but really coordinating them well and coordinating them in a way that leverages existing assets at the local level. And this is what Shape NC has done. The Nutrition and Physical Activity Self-Assessment for Childcare, or NAPSAC program, is offered as part of Shape NC to help staff create healthy policies and environments in childcare settings. NAPSAC is evidence-based and utilizes a proven quality enhancement model, including the provision of a facility pre-assessment to identify gaps and opportunities for improvement, development of a tailored action plan, training and technical assistance for staff, which is so important because they're the ones that really implement the change that affects the children, and a post-assessment of resulting nutrition and physical activity policy and practice change. And I know that Mary will be chatting out links to each of these program components. The second component of Shape NC is Preventing Obesity by Design, or POD. And POD serves as the built environment component of the Shape NC program, and it was developed by the Natural Learning Initiative at North Carolina State University. POD is an ongoing, comprehensive health promotion design intervention that's focused on the outdoor environments of child care centers. The primary goals of POD are to increase early childhood physical activity, food awareness through evidence-informed design assistance, teacher training, and dissemination of information. The POD component in Nash-Edgecombe Counties led to the development of a park which will be used as a demonstration site for early child care professionals, as well as a public gathering space for the neighboring community. Settings in the POD area in Nash-Edgecombe include edible gardens, looped pathways, a gathering lawn, and a natural construction zone, all of which provide opportunities for training with child care directors and teachers, and they also offer opportunities for children in the surrounding neighborhood to engage with nature.
Yeah, Joanne, I think this was one of my favorite ones that we talked about, this natural learning environment, because I think it's really allows communities to get creative, and communities that are resourced differently, so that don't have as many resources to maybe build a brand new playground, can get really creative with creating these natural learning environments. I think we talked about, a mud pit instead of a sand, or a mud box instead of a sandbox, and using old telephone poles to create play spaces. So I think this one has some really cool ideas for how communities can be creative and using their resources and creating fun places for kids to play.
That's right, Kate. And in addition to this outdoor learning initiative approach, really being flexible in terms of, relative to resources, it also, I think, really reinforces the important role of play. That play is a form of activity, and also play is a way of engaging the mind and engaging creativity, as you mentioned.
All right.
So I also want to talk about the third component of Shape NC, which is Be Active Kids. And Be Active Kids is an innovative, interactive, and evidence-based health program for children ages birth to 5. Be Active Kids utilizes a developmentally appropriate curriculum kit and various training models for early childhood settings. Instructional materials provide physical activity content along with instructional strategies in 4 focus areas: motor skill development, health-related fitness, play, and nature. Integrating learning and movement is a key to developing a balanced and healthy child, as we all know, and a child who understands and interacts with the world around them. In addition to the curricula, Be Active Kids offers several training modules based on their 10 components, and this is intended to assist in the continuing education of early childhood professionals. Be Active Kids trainings also align with the North Carolina Division of Child Development topic areas. And so again, just reinforcing the importance, of supporting staff and those that are so instrumental in making sure that these actionable strategies really take hold and are successful in implementation. So now that I've gone through the components of Shape NC and talked a little bit about how it's been implemented in Nash-Edgecombe counties and other counties throughout the state of North Carolina, I want to share sort of what Shape NC is seeing in terms of outcomes. What's really exciting and impressive about Shape NC is that it's had impact in nearly 20 communities across 27 North Carolina counties in which the initiative has been implemented. Major improvements in child care centers over the first 3 years of Shape NC include more active play, limited screen time, and greater access to regular healthy foods and beverages and outdoor play. Just a couple of highlights in terms of outcomes. Over the course of each school year, the percent of children who have reached a healthy weight is gradually improving. Almost 20% of child care centers made improvements to outdoor learning environments, including additions like bike paths and vegetable gardens. The percentage of children who are getting 90 minutes or more of physical activity each day rose from 51% to 85%. The percentage of children being provided with fruit 2 or more times per day rose from 34% to 80%. The percentage of children being provided with vegetables 2 or more times per day rose from 32% to 60%. And there's also been an impact on the staff at these centers. Several have reported that they have improved in at least one of their own health behaviors, including eating more fruits and vegetables and consuming less sweetened beverages and being more physically active.
All right. Well, thank you for sharing that, Joanne, because I think, it's a question people always want to know is, are these programs working? What are they showing? What are they doing in a community? So I think it's great to share some of that evaluation material. I think you made the great point before, Joanne, that, all of these communities are taking, evidence-based models, but they're making them work in their own communities through leveraging partnerships, leveraging resources, and that might look different in each community depending on partners and resources and other things happening there. So I think next you're going to share another great example of a partnership that's making some pretty great systems changes, but maybe doing it slightly differently.
That's right, Kate. And I think, definitely with the Nash-Edgecombe story and what the Down East Partnership for Children was able to do, really shows how having a strong, large partnership, a lead agency that was so skillful and artful in coordinating the work in their community and in their region, and really being able to impact a broad area based on their extensive network. It's just such a great story. And I'm going to tell you next about Charleston, West Virginia, because they also have a great story. And it's one of, again, a strong partnership that coordinated the work very well and achieved scaling through systems change. So a little bit about Charleston first, the community. Charleston is West Virginia's largest city with a population slightly over 50,000. Now, Charleston may be modest in size compared with larger population centers in neighboring states, but it certainly has challenges that are common to many urban communities. The West Side and East End neighborhoods began as the epicenter of the Keys for Healthy Kids, an initiative that addresses both traditional Appalachian diets and sedentary living among residents. While personal motivation for a healthy lifestyle is clearly important, these neighborhoods initially lacked adequate stores selling affordable healthy foods. In addition, safety in nearby parks and active play spaces for children were also of concern in the community. The Keys approach started with community organizing to encourage grassroots efforts and collaboration, and now the partnership boasts 40 organizations in its membership. Keys initially focused within the West Side and East End neighborhoods to improve parks for children, increase community gardens, and create healthier child care environments. With funding through Healthy Kids, Healthy Communities, the Keys Partnership established successful efforts in the early childhood area in these two Charleston neighborhoods. Their Key to Healthy Start initiative includes several coordinated components, including Knapsack, which we talked about in the Nash-Edgecombe story, and that was a self-assessment tool for the child care centers. Workshops and training for child care center staff around nutrition and gardening, physical activity, personal health and wellness, and parent outreach. Another component included guidelines for nutrition policy for the centers based on MyPlate, Leap of Taste, which is the West Virginia state standards. So these policies were very much aligned with existing evidence-based guidelines. Another component of Key to Healthy Start includes education and curriculum for young children about nutrition and physical activity, an ongoing peer learning network, and a platform for reassessment of the child care centers with knapsack for continual quality improvement. Based on the success of the KEYS approach in child care centers in the 2 Charleston neighborhoods, the initiative is now expanding statewide. As a result, Key to Healthy Start, that approach will be implemented in 90 centers within 3 years. A goal beyond year 3 of this statewide expansion is to embed the Key to Healthy Start standards into the quality rating and improvement systems tiered reimbursement system through which centers are financially incentivized to participate.
That's a great example of how you can keep things sustainable.
Definitely through that policy and systems approach. What's also really exciting, Kate, is that the Keys for Healthy Kids partnership is also engaged in broader efforts that will touch the lives of children beyond the early years or beyond the child care settings. Other key accomplishments include the creation of 7 community gardens in the Charleston area. The produce from these gardens go directly to the tables of kids and families working in the gardens, and the surplus food is distributed to local food banks and homeless shelters. Keys for Healthy Kids also established a school and youth garden support network in partnership with West Virginia University Extension. And through this network, 12 school gardens were created, ranging from simple mushroom bags in the classroom to outdoor raised beds. The Garden Network also developed curriculum content to incorporate gardening into the lessons of 26 classrooms for more than 600 children in the area. Keys for Healthy Kids also developed a youth council which builds leadership and advocacy skills amongst Charleston area middle school students. And the youth council has conducted and presented photo voice findings to the West Virginia School-Based Health Assembly, conducted environmental audits, and helped government officials prioritize improvements to city parks for play and city streets for greater walkability. And so while this youth council really engages kids that are a little bit older than what we're focusing on in today's webinar, I just wanted to mention it because it really emphasizes the importance of making sure that the voice of kids and those that partnership strategies are focusing on are really included and acknowledged.
Yeah, I think that's a really important point, Joanne, that when you're building partnerships, remembering that the community is one of your best assets and greatest partners, and making sure that their voice is really involved in the decision making along the way. So this was another great example of a community that started out kind of small with two neighborhoods and is now really moving to scale and thinking about some of those other pieces of the puzzle. And I think one of the really important puzzle pieces to help support and sustain this kind of work that was mentioned here and I think is coming up in our next story is policy. So I think you're going to tell us a little bit about Jefferson County, Alabama, and their work around policy to impact childhood obesity.
That's right. I think the Jefferson County story is definitely one that emphasizes the power of policy and also is a story about affecting county level change, which relates to the county health rankings. So a little bit about Jefferson County. It's the largest county in Alabama and home to 660,000 residents. The county seat is Birmingham, the state's largest city with a population just over 200,000. Jefferson County is comprised of 35 municipalities and 12 school districts, and each of those school districts has its own political structure. The differences between municipalities and school districts presents a challenge, as you can imagine, to adopting and implementing policies, practices, and environmental changes due to each having to be individually approached. But that challenge didn't stop the Jefferson County Health Action Partnership from trying to affect change in their community. And with funding through Healthy Kids, Healthy Communities, a coalition of more than 60 partners really aimed to create a climate for change in their community. This partnership is led by the United Way of Central Alabama, and they really helped motivate and focus the coalition towards specific goals to improve access to healthy, affordable food and safe physical activity opportunities in Birmingham's urban setting, as well as in Jefferson County's suburban and rural communities. The Health Action Partnership's work included efforts to improve policies for young children, and they were successful in working with the Jefferson County Board of Health to unanimously pass sweeping child care regulations impacting over 200 child care providers that care for more than 17,000 children throughout the county. The new rules for child care centers address nutrition, physical activity, screen time, and tobacco use to promote healthy choices for staff and young children in this setting. To assist with implementation of the new regulations, the Health Action Partnership's members created a toolkit and established a referral and monitoring system that provided resources and technical assistance to child care centers. The partnership also made key accomplishments to strengthen policies in other settings, again, to ensure that the influence of healthy environments and a culture of health continue beyond the early childhood years and beyond the child care settings. These include helping to advance school wellness policies in all of Jefferson County's 12 school districts, with 6 districts participating in a wellness policy enhancement process. Specific policy changes affecting over 40,000 students relate to after-school wellness, food procurement, and safe routes to school encouragement and enforcement. The Health Action Partnership also collaborated with the City of Birmingham's Department of Planning, Engineering, and Permits to update its zoning ordinance, and the new zoning changes recognize established urban farms, community gardens, and fresh food markets.
Awesome. I'm going to give a shout out to Birmingham. It was my home for 2 years during grad school, and I actually used to go and volunteer on one of the urban farms there. So it's awesome to hear about the great things that they are doing to improve health and to improve the health of kids in particular. And Joanne, I think, I really thank you for sharing the work of these 3 communities in particular. And I think one cool thing about your work, similar actually to the work that we do as coaches, is that you get to see a lot of communities in action in this particular area. And that means you have a broad perspective and you can glean some themes and overarching lessons and challenges and what's worked and what doesn't always work that's led communities to be more successful. So let's go and see what we can learn from a few. We've learned from a few of specific communities, so let's see what we've learned from work more broadly.
Yeah, and Kate, I really, really want to emphasize that the thanks and all the kudos go to the communities that really, again, so artfully and skillfully coordinate the work on the ground and do it in a way that is informed by their community and really draws and leverages on their partnerships and the assets in the communities. And Active Living by Design does have the privilege of being able to work with so many and a variety of communities across the nation, and so that we can start to see what are the common challenges, what are the common lessons learned, and try to inform the broader field of healthy communities in that way. And that's how we see our role. In terms of just some challenges, I think, and lessons learned that we see around the work, that involves being able to draw on model approaches and promising practices. How do you do that in a way that's going to have impact and that you can scale? one of the challenges, I think, is that policies and programs don't reach all children due to issues such as exemptions in child care center regulations and policies, limited resources for across-the-board environmental changes. Yet, while every successful policy and environmental change may not impact everyone in a community or every child, if we're talking about early child care settings, we can see from the stories that we shared and others just how they can be powerful in building positive movement and momentum for healthy communities. So, just as Charleston started with a focus into neighborhoods, we see that over time they were able to build on that success and scale it up to a state level. A second challenge, I think, is that comprehensive and well-coordinated efforts, such as the ones that I've shared, clearly require community partners to think broadly and about how their areas of focus and expertise relate to a broad definition of health across all health factor areas. And sometimes there can be a potential for lead and partner organizations to experience mission drift without upfront and clear partnership agreements regarding roles and contributions. And, the Down East Partnership for Children story is a great example. They were really focused on early childhood development and education, and they were able to so skillfully tie health in to that work and really leverage expertise and bring in partners who had strong health backgrounds to join their efforts. And so I think, the whole trying to build comprehensive partnerships and well-coordinated efforts reinforces that the scope and complexity of healthy community work is most effectively conducted by collaborative multidisciplinary partnerships. In terms of key lessons learned and things that I think we continually see reinforced, one is that implementing models and programs as part of a comprehensive initiative requires careful and strategic coordination and partnerships, but they're so worth the investment for long-term community change. A second key lesson learned is that leveraging and coordinating resources and partnerships really lead to greater impact and stronger capacity that hold more promise for sustaining a healthy community. And Kate, because we've had the privilege of working with so many wonderful, successful communities, the Healthy Kids, Healthy Communities Lessons for Leaders I think is a document and a resource that I want to point out to your audience today. I think it may be of particular interest as it highlights examples and stories from local level leaders and partners who have been working to make their communities healthier. Each lesson in the Lessons for Leaders document is illustrated by community stories from Healthy Kids, Healthy Communities partnerships, and they're briefly described in the document with more complete stories available on our website. Across the Healthy Kids, Healthy Communities and other portfolios and projects that we've been able to work with, Active Living by Design has had the privilege of working with these great community partnerships that have not only achieved significant accomplishments related to obesity prevention, but also they've utilized approaches and strategies that connect to broader community impacts in building a culture of health.
Great, thanks, Joanne. And I think we're running short on time in terms of having time for questions. So I do want to note that you have some great other resources available on your website.
And so real quickly, we've got other documents, some of which that grew out of the Healthy Kids, Healthy Kids initiative, but also great resources for funders or those who want to invest in healthy community change. And then I just want to invite the audience to visit our website and connect with Active Living by Design on social media. We'd love to hear from you. We'd love to hear about your community stories and successes and how Active Living by Design might be able to partner or engage with your community in the future.
All right. Thank you so much, Joanne. The stories were great, and I hope that communities and those listening got some ideas to take back to their own local community partnerships. I'm going to really quickly walk through, Joanne shared some great examples of strategies that communities are using to prevent childhood obesity, and Mary's been chatting those out. We know there's a lot of other things that communities can do and are doing. What Works for Health, found under the Roadmaps to Health tab on the County Health Rankings website, is a great resource for strategies that you can take a look at to see what would make the most sense for your community. We're not going to do a full tour today, but there is a tutorial on the website for you to check out if you aren't familiar with it yet. When we look at diet and exercise, there are 66 programs and policies that are related to diet and exercise on the site. You can see on the left sidebar, you can filter by different approaches. You'll also see that these are alphabetically listed here, and there's different levels of evidence of effectiveness. There's a few that are scientifically supported, some with expert opinion, some with some evidence. If you scroll down on that left bar, you could also sort by that evidence of effectiveness. And if we say only wanted to look at scientifically supported strategies, we could do that, and we'd see that there are 22 strategies that are scientifically supported, our highest evidence rating, for addressing diet and exercise issues in your community. You'll see that we talked about kids today. There's one right there that's programmed for older adults, if that's a population that's of interest or importance in your community and that you're thinking about. So there's lots of different ways to approach this issue. We do have a strategy in there, nutrition and physical activity interventions in preschool and childcare. So if this webinar was particularly of interest to you today, that topic, this might be a great one for you to check out. You'll see that it is scientifically supported. So really brief overview of what works for health, but I do want to have time for a few questions. So Mary, questions that have come in.
Yes. One question that was asked is, what are some effective methods to gain community buy-in for initiatives around diet and physical activity?
Well, I can start with that, Joanne, and then I might turn that to you as well. But I think Joanne actually gave a lot of great examples of that. A big part of community buy-in is community engagement, is getting the community involved in the conversation. The youth action group, or the youth committee that was started, is a great example of that. We often remind people, don't invite people to your table, go to theirs. So going and talking with people in the community about what they want, what they need, what are their challenges. I think sometimes the buy-in isn't there because we're solving problems for people and not with people. And so really thinking about that community engagement piece, our work together guide can be helpful with that, I think is a big piece of that puzzle. So Joanne, any other thoughts on that?
I completely agree, Kate, with what you said, and just a few specific examples of how that community engagement might look. So, for example, Downey's Partnership for Children, they have residents and they have parents of children who are served at the child care centers as part of their partnership. So they're at the table, and again, they provide such a valuable lens that can really ensure that the strategies are successful.
Thanks, Joanne.
All right, another question that has come in is, what can city and county governments do to help citizens increase their physical activity?
I think that's a great question. So, this diet and exercise comes under health behaviors, and we often think, we need to encourage people to eat healthier and exercise more. But we know that, as we talked about when we looked at those measures, that your environment really impacts your ability to do those things, what your choices really are. So I think city government, county government, any government leaders can think about, is there green space? Are there trails? Are there safe sidewalks in the community? And are those places safe? Do people feel like they can get outside and feel safe doing that and engage with other people in the community? Is there access to healthy food? And not just, a lot of times we think, is there a grocery store in our neighborhood, or is there, or do people have money or the ability to afford healthy food? Transportation comes into play. So is there transportation that allows people to get around their community to access healthy, nutritious food? So really thinking about not just if people aren't making healthy choices, do they actually really have those healthy choices? And how do we create a community when we get planners involved and other people to think about creating a community that actually makes those choices easy and real choices for people?
And Kate, I would also say that government leaders can and should engage with the local partnerships. So, Jefferson County was a great example where they partnered with the Department of Planning, Engineering, and Permits to change zoning so that those environments were healthier for the community. So really, view your government leaders as allies and potential partners.
Yeah, I think that's a great point that government leaders are allies and it's
Mhm.
just finding the sort of what their interest is. So I know we have a lot of other questions coming in. We are out of time, but we will work to get back to each of you who have asked a question and make sure we respond to those. Um, we had lots of information to share today, and I just want to wrap up with a few more slides, reminding you all that we do have 11 community coaches thanks to the support of the Robert Wood Johnson Foundation. We have 4 based in Madison, Wisconsin, and the rest regionally around the country. Our assistance is available to you at no cost. Please connect with us. We do respond to every email that we get and work to get back and answer your questions and help you work through this challenging process of building partnerships and making significant and sustainable change in your communities to make them healthier places. We too have social media, so you can follow us on Twitter, you can like us on Facebook. We have an e-newsletter. It will let you know about things like this webinar today. We encourage you to sign up. And we have many great partners. Just like we talked about partnership today, we do this ourselves. We have many great partners that work on this project with us. Active Living by Design, named right there, is one of our great ones. And so we thank them for joining us today and thank all of you for joining us today. And we know that lots of you care about diet and exercise, and we know that lots of you are working to improve this issue in your communities. And we hope that today's webinar gave you some more examples of how you can continue this challenging but really important and essential work. So thanks so much, Joanne, for joining us.
Thank you, Kate.
And thanks everyone on the webinar for joining us, and have a great afternoon.
Good afternoon, everyone.